If you are dealing with bladder leaks or pelvic pain, or even just like a feeling of heaviness, you've probably been told to do Kegels, like just squeeze the muscles down there.
Right, the classic advice.
Yeah, exactly. Because we assume, if you have a physical problem, the solution has to be localized. You hurt your knee, you ice your knee. But what if the actual cure for your pelvic issues has like absolutely nothing to do with your pelvis and literally everything to do with your lungs?
It's a complete paradigm shift for most people.
Yeah.
I mean, the idea that your lungs dictate what happens to your bladder sounds totally absurd.
It really does.
Right, until you actually look at the mechanics of the human body. Because we've been conditioned to look at the pelvic floor in just total isolation, which is exactly why so many people never find relief.
Yeah.
You really have to look at the entire abdominal canister.
And that is exactly what we are exploring today in this deep dive. We are answering a very specific, frankly, fascinating question. Can diaphragm-focused breathing exercises actually reduce the downward pressure vector on the urinary bladder?
Such a great question.
Yeah, and to figure this out, we've got a whole stack of sources. We're going to look at everything from clinical biomechanics studies to dynamic MRI studies tracking internal organs in real time. We've even got physical therapy protocols used on everyone from like 5-year-olds to elite athletes.
The range of data is incredible, yeah.
It is. So, okay, let's unpack this. Because to understand how the lungs and the bladder are mechanically linked, we really need a totally different mental model of the human core.
We do, yeah. When most people hear the word core, they immediately picture, the superficial six-pack muscles, the rectus abdominis.
Like the cover of a fitness magazine?
Exactly. But functionally, your core is not a washboard. It's a pressurized cylinder. So imagine a dynamic, flexible canister, right? The roof of this canister is your thoracic diaphragm, which is your main breathing muscle sitting right under your lower ribs.
Okay, the roof is the diaphragm. Right. And then the floor of the canister is your pelvic floor muscles. And wrapping around the thighs, forming the walls, are your deep transverse abdominals and your back muscles.
Got it. And this canister isn't empty, right? It's packed full of your abdominal organs, your viscera, and fluid. And if you remember high school physics, fluid does not compress.
No, it doesn't.
So any change in the shape of this canister instantly changes the pressure inside of it. And one of the sources had this amazing analogy for it, Mary Massery's soda pop can model.
Oh, I love this analogy. It's so clear.
Yeah, it's brilliant. Basically, if you have a sealed, unopened can of soda, it is incredibly strong. Like you can literally stand on an unopened aluminum can and it won't crush because the internal pressure is perfectly regulated.
Exactly. What's fascinating here is that this works perfectly until there's a weak point. If there is a structural weakness or a micro tear at the bottom of that can.
Which in our body represents the pelvic floor.
Right, exactly. If the bottom is weak and you apply pressure to the top, you get a blowout because pressure always takes the path of least resistance. In the human body, that blowout looks like urinary incontinence or a pelvic organ prolapse where the organs actually, begin to descend.
Wow. So, okay, how does breathing dictate that pressure? Walk me through what's happening to the organs when we just take a normal breath.
It's essentially a piston system, and it's in constant motion. So when you take a breath in, your diaphragm contracts. Now, because the diaphragm is shaped kind of like a parachute or a dome, contracting actually means it flattens out and moves downward into the abdominal cavity.
Pushing everything down.
Exactly. As it pushes down, it creates intra-abdominal pressure. The organs have to go somewhere, so they shift down and slightly outward. To absorb this downward shift, a healthy pelvic floor has to relax, stretch, and lengthen downward. It yields to the pressure.
Okay, so on the inhale, the roof goes down and the floor goes down.
Correct. And then on the exhale, the diaphragm relaxes and moves back upward into its resting dome shape. The pressure lifts, and the pelvic floor, which is highly elastic, passively recoils and lifts back up right alongside it.
They're moving in parallel.
It's a completely synergistic dance, yeah.
That's wild. The roof and the floor are just dancing together all day long. And considering the average person takes about 20,000 breaths a day, that is 20,000 times your pelvic floor is supposed to gently stretch and recoil.
Yes, theoretically.
But what happens if you're a shallow chest breather? Because let's be honest, when I'm stressed, my shoulders are up by my ears and I'm barely breathing into my chest.
Well, that is exactly where the dysfunction starts. If you are shallow breathing into your upper chest, your diaphragm isn't descending fully. It gets stuck in this high, rigid position.
Oh, I see.
And because of that, your pelvic floor never gets that regular rhythmic stretching. It becomes completely stagnant. Mhm. And when a muscle sits in a stagnant, tense state all day, it actually becomes incredibly weak. It loses its elasticity. It basically becomes a rigid floor instead of a flexible net.
So it completely loses its ability to absorb any sudden changes in pressure?
Precisely. The pressure vectors in that soda pop can go completely rogue because the roof and the floor are completely out of sync.
Okay, so if that's the damage we can do just by, like, sitting at our desks, breathing poorly, what on earth happens when we actually put this system under extreme stress, like lifting a heavy box or doing a heavy squat at the gym? This downward pressure issue must go from being a subtle mechanical quirk to a massive visible problem.
It really does. And to understand why, we have to talk about the Valsalva maneuver.
Right.
So Valsalva is when you take a deep breath in, you close your glottis, which means basically sealing off your airway in your throat,
Hmm.
and then you bear down and strain.
It's the classic hold your breath and push move, like what everyone naturally does when they try to move a heavy couch.
Right. And clinically, it is an absolute disaster for the pelvic floor. When you do a Valsalva, you are forcing that diaphragm into a low flattened position, and then you're trapping it there. Because your airway is closed, the pressure has no upward escape route.
Nowhere to go.
Exactly. So when your abdominal walls contract to lift the heavy object, they aggressively squeeze the sides of the canister. With the roof locked down, an enormous vector of downward force is driven directly onto the bladder and the pelvic floor.
And researchers actually wanted to see what this looked like inside the body, right? So they put the 30-year-old totally healthy woman in an MRI machine. She had completely normal pelvic floor function.
Yeah, this study was eye-opening.
Totally. First, they had her squeeze her hands with maximum force while holding her breath, so doing that Valsalva maneuver. And the real-time MRI literally showed her pelvic floor being visibly pushed and crushed downwards by the internal pressure.
But the crucial part of that study is what they had her do next. They had her do the exact same maximum hand squeeze, generating the exact same amount of physical force, but this time they told her to exhale through an open airway while she squeezed.
Just breathing out normally.
Right. And the MRI showed her pelvic floor and her diaphragm safely moving upward in parallel. Because the airway was open, the pressure safely escaped up and out instead of crushing down onto her bladder.
Which was completely backed up by that clinical biomechanics study they did with 31 healthy participants. They wanted to measure this exact pressure, so they used anorectal manometry.
Which sounds intense.
Yeah, it's a probe that measures pressure in the rectum to gauge the pressure inside the entire abdominal cavity, and they paired it with a DNS brace, which is basically a specialized sensor belt that measures the outward tension on the abdominal wall.
And the data from that was undeniable. There is an extremely strong correlation between intra-abdominal pressure and abdominal wall tension. Out of all the scenarios they tested, resting, holding weights, normal, exhaling the Valsalva maneuver, created the most intense, violent intra-abdominal pressure spikes by a massive margin.
Okay, wait. I actually have to push back on this, because my trainer literally yells at me to take a massive breath, hold it, and brace my core before I do a heavy deadlift.
Oh, I'm sure they do.
Right. Weightlifters do this intentionally to stabilize their spine. Are you saying everyone in the gym is just setting themselves up for a pelvic organ prolapse? I mean, isn't that pressure necessary to protect your back?
It is a brilliant question. And it's actually the center of a huge debate between sports biomechanics and pelvic health experts.
Yeah.
Holding your breath and creating massive intra-abdominal pressure absolutely stabilizes the lumbar spine.
Okay, so it does work.
It does. One of the papers we looked at used a fantastic analogy for this. A highly pressurized core gives your arms and legs a stable foundation to work from. It's like firing a heavy cannon from a large, rigid battleship. It's safe and effective. But if your core is weak, it's like firing that same cannon from a flimsy rowboat. The recoil will destroy the boat.
So holding your breath turns you into the battleship.
Exactly. It protects the spine. But it is a physiological trade-off. By locking that pressure inside, your spine is safe, but your pelvic floor has to bear the absolute brunt of that internal explosion.
Oh, man.
Yeah. If your pelvic floor is incredibly strong, maybe it can withstand the blast. But for most people, the bladder pays the price. Over time, that repetitive crushing downward force stretches the ligaments and leads to leaks. So the physiological ideal for most daily exertion, whether you're picking up a heavy bag of groceries or a dumbbell, is to exhale on exertion through an open glottis. It lets the pressure vent upward rather than acting like a battering ram into your pelvis.
Okay, that makes sense for things I can control. If I know I'm about to lift a box, I can consciously plan to exhale on the hard part.
Right.
But what about when I can't control it? Because sudden involuntary pressure spikes are famous for causing urinary leakage. I'm talking about like a violent sneeze or a heavy cough.
Yeah.
You can't exactly plan a slow, controlled exhale when you sneeze.
No, you definitely can't. And a strong cough can generate transient intra-abdominal pressure spikes exceeding 150 centimeters of water.
Wow. Which honestly sounds a bit abstract. What does 150 centimeters of water actually feel like to the body?
Imagine instantly dropping a 15-pound bowling ball directly onto your bladder.
Oh my God.
Yeah, it is a sudden, violent downward force. To handle that shock wave, the body relies on an automatic reflex that clinicians call the knack.
The knack, it sounds like a secret superpower.
Yeah. It really is, though. The knack is a perfectly timed preliminary pelvic floor contraction that happens just milliseconds prior to a cough or sneeze. In a healthy nervous system, your brain anticipates the sneeze, fires the pelvic floor muscles to brace the bottom of the canister, and then the sneeze happens.
Okay, here's where it gets really interesting because I want to untangle an analogy from the sources here. It's so crucial for visualizing how the knack actually prevents leaks.
Yes, the trampoline analogy.
Right. We talked earlier about how the pelvic floor needs to act like a trampoline during normal breathing, yielding, and bouncing back. But during a violent cough, a trampoline is the last thing you want. Think of your urethra, the tube that carries urine out of the bladder, as a garden hose.
Okay.
If that hose is resting on a soft trampoline and you step on it with heavy pressure, the hose doesn't get pinched shut. The trampoline just sinks down under the weight, the hose stays round, and water keeps flowing. In our bodies, that means urine leaks out.
That is a perfect visualization of dysfunction. The foot stepping down is the violent downward pressure from a cough. If your pelvic floor is acting like that soft trampoline during a high-pressure event, the pressure just pushes the urethra down, it doesn't seal, and you leak.
Right. But if you have the knack, your pelvic floor pre-contracts before the cough hits. It temporarily stops being a trampoline and becomes solid, like concrete. So when that violent pressure steps down on the garden hose, the hose is crushed against the concrete floor. It pinches completely shut, and not a single drop of water or urine escapes.
Exactly. If we connect this to the bigger picture, it needs to be a trampoline 99% of the time, but solid ground for the split second of a sneeze. But here is the problem. Dysfunctional breathing breaks this reflex.
It does.
Yeah. When we breathe shallowly and keep the core constantly braced, the nervous system gets confused. The brain stops communicating properly with the pelvic floor, and you lose the knack. The automatic brace just stops happening.
So how do you get it back? Because you can't just do endless Kegels to fix a neurological timing issue.
Yeah. No, you can't. You have to retrain the communication system. And researchers proved this in a really fascinating 2022 study looking at patients with urge incontinence. They took these patients and split them into two groups. Group A only did pelvic floor muscle exercises, basically just Kegels. Group B did pelvic floor exercises, but they were also trained in diaphragmatic breathing.
Let me guess, the breeding group had better results.
Significantly better.
Yeah.
Both groups saw some improvements in stress leakage, which is the leaking you get when you jump or cough. But only the group that incorporated diaphragmatic breathing saw a massive reduction in urgency and urge incontinence, which is that sudden, terrifying need to run to the bathroom immediately.
Wait, how does breathing fix an overactive bladder muscle? That seems crazy.
It works by regulating the nervous system. Deep diaphragmatic breathing activates the parasympathetic nervous system, the rest and digest state. It calmed the neurological signaling and literally stopped the bladder muscle from violently spasming.
That is wild. And this communication breakdown isn't just an adult issue either. Researchers looked at a group of pediatric patients, kids between 5 and 13 years old, who had dysfunctional voiding. Basically, these kids were holding their pee, and because they were terrified of wetting themselves, they developed terrible breathing habits. They were constantly bracing their abdominal walls and keeping their pelvic floors locked up tight all day long.
Right. And because their pelvic floors were locked up, they could never fully relax to empty their bladders completely when they did finally go to the bathroom.
Right, which leaves stagnant urine sitting in the bladder, and bacteria love stagnant urine. So these poor kids were getting constant urinary tract infections. The researchers wanted to know if fixing their breathing could fix their bladders. So they put the children through 12 months of diaphragmatic breathing and pelvic floor retraining.
And the biological cascade of cause and effect here is stunning. By learning how to breathe deeply, the kids learned how to relax the pelvic floor. Because the floor could relax, they could finally empty their bladders completely. No stagnant urine meant no bacteria multiplying.
Mm.
As a result, 68% of them became completely free of UTIs, and 83% stopped experiencing incontinence entirely.
Just by learning how to breathe and coordinate the canister.
It's amazing.
And for anyone listening who wants to experiment with this retraining, the clinical data suggests that the quadruped position, like getting down on your hands and knees like you're crawling, is one of the absolute best ways to feel this synergy.
Yes, it's highly effective because it removes gravity from the equation. When you are on all fours, the weight of your abdominal organs is no longer pressing down onto the pelvic floor. It allows your brain to truly feel the mechanics, like you inhale, the belly expands toward the floor. You exhale, the belly and the pelvic floor gently draw back up. It resets the entire piston system.
Okay, so if exhaling manages downward pressure and being on all fours neutralizes it, is there a breathing technique that actually pulls the pressure you pee? Because I was reading this section in the sources on hypopressive abdominal exercises, and the mechanics sound physically impossible.
I know, they sound strange, but they are very possible. And they are actually a cornerstone of modern pelvic rehabilitation. Hypopressives, also known as low-pressure fitness, were developed in the 1980s by a European doctor named Marcel Coffries. He was desperately looking for a way to help postpartum women restore their core strength without doing traditional crunches.
Oh, because a crunch is awful for the pelvic floor.
Oh yeah, because as we know now, doing a crunch is basically folding the soda pop can in half.
Yeah.
It massively spikes downward pressure on already vulnerable pelvic floor.
So how does a hypopressive reverse that? Walk me through the mechanics, because I am genuinely struggling to picture this.
Sure. It is essentially the exact inverse of the Valsalva maneuver we talked about earlier. With a Valsalva, you inhale air, close your throat, and push down. With a hypopressive exercise, you fully exhale all the air out of your lungs, every last drop.
Yeah.
Then you hold your breath on empty. You keep your glottis, your airway, completely closed, even pinching your nose if you have to. And while holding that empty breath with a sealed airway, you perform a false inhale.
Wait, hold on. If my throat is closed and I'm not breathing in any air, how can I inhale? That physically doesn't make sense to me.
You aren't actually inhaling air. You are mimicking the mechanical action of the rib cage. Like, try it right now. Breathe all your air out.
Okay, breathing out.
Now plug your nose and close your mouth. Now try to dramatically flare your ribs open as wide as you can, as if you were trying to suck in a massive breath of air.
Oh, wow. Okay, my ribs are flaring, but because no air is coming in, my belly is just violently sucking deeply up and underneath my rib cage. It literally feels like a vacuum.
That is exactly what it is.
Yeah.
For anyone who practices yoga, this is functionally the same mechanic as Uddiyana Bandha. By expanding the ribs with a closed airway, you create negative pressure in the thoracic cavity. You create a physical vacuum. This vacuum intensely sucks the relaxed diaphragm upward into the chest.
So the roof goes up.
Yes. And because the diaphragm is the roof of the abdominal canister, when it gets sucked up, it pulls the abdominal wall inward, and it passively pulls the pelvic organs, the uterus, the rectum, and the urinary bladder upward along with it.
It is a literal mechanical lift for your internal organs. And researchers can see this working in real time, right?
They can.
Yeah, they use transabdominal ultrasound imaging to watch the bladder. When a patient just did a normal Kegel, the ultrasound showed a little bit of upward lift. But when they had the patient perform this hypopressive vacuum technique at the same time, the ultrasound showed a significantly greater dramatic lift of the entire bladder.
Because it's utilizing the body's fascial connections. There is this tubular fibrous structure called the urethus ligament. It connects the umbilicus, your belly button, directly to the apex or the top of your bladder.
Oh, I see.
Yeah. So when you perform that vacuum and your belly button is drawn deeply up and in, it physically pulls on that ligament, acting like a crane lifting the bladder from above.
That is so cool. So what does this mean for the listener? Do they need to walk around all day exhaling and holding their breath in a vacuum just to keep their bladder from leaking?
Oh, no, absolutely not. Hypopressives are a rehabilitation tool, not a permanent lifestyle modification. By practicing this vacuum technique for short intervals during a workout, you are doing a few vital things. You are temporarily relieving chronic resting pressure on the pelvic floor. You are improving the elasticity of the fascial tissues, and you are subconsciously retraining your deep core muscles. It teaches your nervous system that the baseline state of your abdomen doesn't have to be constant, heavy downward pressure.
It basically resets the default setting.
Precisely. The goal is that by doing these exercises, your body learns to automatically regulate pressure better during your normal unconscious breathing throughout the day.
We have covered a massive amount of ground today. Let's bring it all back to our original mission statement. Can diaphragm-focused breathing exercises actually reduce the downward pressure vector on the urinary bladder?
The clinical evidence is definitive.
Yes.
Whether it's restoring the normal inhale-exhale piston rhythm to stop the pelvic floor from becoming rigid, or learning to exhale on exertion to avoid the crushing downward spikes of lifting heavy objects.
Or utilizing hypopressive vacuums to physically lift the viscera.
Exactly. Your breathing mechanics are undeniably the remote control for your pelvic floor.
The roof controls the floor. It is all connected.
Yeah.
And, as we wrap up, I want to leave you, the listener, with a final thought to mull over today. Think about modern societal beauty standards.
Yeah.
Think about how often we are subtly or, not so subtly pressured to walk around constantly sucking our stomachs in to look thinner.
It's so common.
It really is. Based on everything we just learned about the soda pop can model, think about what you are actually doing to your body. If you are walking around all day constantly bracing your abdominal walls inward, you are fiercely squeezing the sides of the sealed can. Where does all that internal pressure have to go? It can't go out through the rigid walls you're flexing. It can't go up if you're breathing shallowly into your upper chest. It has no choice. It goes straight down.
It's a constant strain.
Right. By simply sucking your stomach in for vanity, you are sending a constant, unyielding vector of pressure directly onto your pelvic floor and your bladder every single minute of the day. So, could this simple act of finally letting your belly go soft and actually taking a deep breath into it be the most profound thing you do for your pelvic health today?
It certainly highlights how our pursuit of a flat stomach might literally be driving our organs downward.
Exactly. Sometimes fixing the complicated issues at the bottom of the canister just requires letting out a deep sigh, relaxing your belly, and finally letting the pressure go.